Hi everyone, very good morning. Today we will try to understand the competency based questions from our chapter 4. Class 12 Psychology chapter 4 is actually the psychological disorders. We can say that how the psychological disorders are, you know, analyzed and understood for the sake of our upcoming board examination purpose. So in this situation we will try to look into the aspects here. So I divided this chapter into three parts: part A, part B, part C, and most of the questions are 1 mark short answers with MCQ type only created. In the second version we will try to see the case based questions and application based questions from the chapter 4. Now the first question: which of the following best describes the primary characteristics of GAD? So what is the first quality of the GAD? If you see, it is the generalized anxiety disorder. An individual thinks that he or feels that he is experiencing the anxiety without any valid reason. In GAD, people are constantly scanning the environment for threats and dangers. So here the given ABCD options, if you see: persistent and excessive worry about everyday events, that is the right answer. Sudden intense episodes are, this is the second one, panic disorder. I'm sorry. The third one is indicating the phobias, and the fourth one is indicating again the phobias. You see. Now, what is the defining feature of a panic attack in the context of panic disorder? Yes, a sudden overwhelming surge of intense fear or discomfort accompanied by physical and cognitive symptoms. So option A is the right answer for this also. You see, a persistent and irrational fear is basically specific phobia. A generalized state is GAD. Feeling of intense worry about social situations, if you take here, that is basically the agoraphobia. Now, the third one: which of the following is a core diagnostic criteria for panic disorder? The panic disorder refers to recurrent anxiety attacks or frequent episodes of out of control anxiety. Now look into this area: chronic and excessive worry about multiple life domains. No. B, recurring unexpected panic attacks and persistent worry about future attacks. Yes, option B is the right answer here. Option B, it's a recurring unexpected panic attacks is the right answer. Option C, if you see here, this is basically again talks about the phobia, agoraphobia. Option D, if you see, avoidance of specific objects or situations due to intense fear. This is again phobia, specific phobia, because specific objects the answer is very clear to us here. Specific we are calling. Now the fourth one: a client presents with an intense and irrational fear of heights, acrophobia. Okay, this is a specific phobia. What is considered the most effective psychotherapeutic intervention for this specific phobia is exposure therapy. I can use the word here as per our syllabus. It is the systematic desensitization technique. And systematic desensitization technique, we have the concept here. You look into this area, exposure therapy we are using. The question number 5, if you see, beyond specific symptom criteria, what is the crucial general criteria for diagnosing an anxiety disorder such as GAD or phobia? If you see 5B, significant distress or impairment in social, occupational or other important areas of functioning. 5B is the right answer. Sixth one: which scenario is most characteristic of SAD? So separation anxiety disorder. The sixth one again, option B, an intense fear of public speaking or performing in front of others. See, most characteristic of SAD, if you see here, SAD, social anxiety disorder. My children, I'm sorry, someone tried to disturb the class little bit, so I just get confused. Okay, social anxiety it is. Sorry, SAD is two types are there: social anxiety or social phobia. Again, we have SAD, separation anxiety disorder. The sixth one, right answer is B here. Seventh one, what is the primary defining characteristic of phobia? If you see here, seventh one again option B, a specific irrational fear of an object or situation that leads to avoidance. Question number 8, a key feature differentiating social anxiety disorder SAD from other anxiety disorders. See here, anticipatory anxiety about social events and avoidance of social situations. You look into this area. So, social anxiety disorder, what is the key feature you see? Anticipatory anxiety about the social events and avoidance of social situations. Which statement accurately describes a central element of panic disorder? So, always try to understand, whenever you are going to write the CBQ, first your concept should be clear. So first thing you need to understand, what is the concept actually? Panic disorder, frequent episodes of out of control anxiety or recurrent anxiety attacks, you see. So recurrent unexpected panic attacks and at least 1 month of persistent concern or worry about additional panic attacks are their consequences. 9, option C is the right answer for question number 9. Let's make a move to part B. Part B, here it is, applications are there. A client reports experiencing recurrent intrusive thoughts about germs and contamination, which causes significant anxiety to alleviate this distress. So you see here, it is the obsessive compulsive disorder, my children. Obsessive compulsive disorder includes obsessions and compulsions. Obsessions are an inability to control certain negative thoughts. Compulsions are an inability to control certain actions. That is basically option C. OCD is the right answer. Obsessive compulsive disorder. Question number 2. Which of the following best describes the relationship between obsessions and compulsions? You see, as I told to you, obsessions are the intrusive thoughts and the compulsions are mental acts or behaviors performed to neutralize the obsessions. Yes, question number 2, option B is the right answer. Now, a 25-year-old individual presents with a significant hair loss, primarily from their scalp and eyebrows. They report that they frequently pull out their hair. Yes, hair pulling disorder. Scientific name is trichotillomania. Trichotillomania is a part of OCD. Now, what is the key differentiating feature between trichotillomania and typical self-grooming behaviors? You see, my children, here, the hair pulling causes noticeable hair loss and you see significant distress or impairment. You can look into this area. The hair pulling, basically there are some people, they have the habit of pulling their hair, they just, whenever they have stress, they pull their hair, and significant distress or impairment will be there. A client frequently picks their skin, primarily on their face and arms, leading to noticeable skin lesions, infections and scarring. They report difficulty stopping the behavior despite wanting to it and causes them considerable embarrassment. This symptom is what exactly? See, excoriation, skin picking disorder. Some people have the habit of peeling the skin, you see, on the lips. Basically they pinch, they damage their own body, their own skin, until they don't get the pain, they don't feel satisfaction. This is excoriation. There is another scientific name for this one, dermatillomania we are calling. We will call this excoriation or skin picking disorder with another name out of textbook, dermatillomania. For a diagnosis of hoarding disorder, the primary concern, what is exactly hoarding disorder? You see, people do an excessive amount of shopping. After that, they feel that there is a threat for those collected or gathered items. In hoarding disorder, generally they will have. So collecting the things is not a disorder, but after the collection, getting worried about the safety is the disorder here. Now the question number 6, if you see here, B, option B is the right answer. Persistent difficulty discarding or parting with possessions regardless of their actual value. Now, a common consequence of hoarding disorder, distinct from simple clutter. What exactly? You see the common one here, it is significant distress or functional impairment due to cluttered living areas rendering them unusable. Means 7th one, option B is the right answer. A significant distress or functional impairment due to cluttered living areas rendering them unusable. A patient frequently presents the emergency room complaining of severe diffuse body pain, fatigue, headaches. Medical evaluations consistently show no underlying physical cause. Yet the patient remains convinced of a serious physical illness. Yes, this presentation is basically which disorder? If you see, this is called somatic symptom disorder. Now you look into this area. The question of 8th one is a somatic symptom disorder. For example, you see, you will get confused here. The word is used here, conversion also they gave one word actually, but it is not that one. Why? Somatic symptom, people experiences physical symptoms without any evidence. Illness, anxiety, people experiences the anxiety symptoms without any evidence. Conversion disorder, reported loss of basic body functions. Now, which feature is most central to the diagnosis of somatic symptom disorder? You see, question number 9, if you see here, significant distress or functional impairment due to thoughts, feelings and behavior related to somatic symptoms. This is the right answer to diagnose the somatic symptom disorder. If you see the presence of medically unexplained symptoms, medically explainable it is. Pain disorder, people feel the pain. Preoccupation with having serious illness, even without preoccupation with having serious illness is illness anxiety. Option C is the somatic symptom. Intentional production of false exaggerated physical symptoms also not right, because option C is more suitable. A young woman, you see here, a young woman develops sudden unexplained and blindness following a traumatic event, but medical explanations including neurological assessment reveal no organic basis. Yes, so people feel that they are sick from a long period of time, or they feel that they are sick, they lost their basic body functions, that is called as conversion disorder. You feel one part of the body is not working in a proper way. Just a minute, guys. Now, the hallmark of conversion disorder, if you see, functional neurological symptom disorder. We have another name for conversion, functional neurological symptom disorder. The hallmark is physical symptoms affecting voluntary, motor or sensory function that are inconsistent with known neurological or medical conditions. A patient spends an excessive amount of time researching various diseases online, frequently seeks reassurance from doctors despite being told they are healthy, and remains highly anxious. Yes, it is the C, illness anxiety disorder. See, this illness anxiety, earlier known as hypochondriasis. In this disorder, people feel that they are sick, but they feel that, you see here, they express that sickness in terms of anxiety. They just worry. And also when they hear about someone's sickness or illness, they start thinking that they are also going through the same kind of problem. That is the illness anxiety. Now, what is the primary difference between the somatic symptom and illness and anxiety in terms of expression? Somatic symptom is expressed in terms of physical symptoms, whereas illness anxiety expressed in terms of anxiety symptoms. So option B is the right answer. Now part C. There are 10 questions, my children. We'll complete this also. A psychologist operating from the psychodynamic model would most likely attribute a client's severe anxiety and repetitive hand washing to which underlying cause? For example, psychodynamic model, any disorder they perceive in terms of unconscious conflicts or repressed motives or unfulfilled childhood desires. You see here. So psychodynamic, Freud, what actually according to Freudian psychodynamic model, the reason behind psychological disorders basically, first is conflict between id and ego, unconscious conflict, we will call this one. Repressed memory, you see here, unconscious basically full of repression. So 1C, option C is the right answer, from early childhood experiences, you see. Now the second one, according to psychodynamic perspective, what is the primary function of defense mechanism in the context of abnormal behavior? See, defense mechanism is a way of reducing the anxiety by distorting the reality. So here it is, to protect the ego from anxiety arising from unacceptable unconscious impulses or conflicts. Now option C is the right answer. A cognitive therapist is working with a client suffering from depression. Which of the following interventions would be most characteristics of this model's approach to abnormal behavior? Don't get confused, my children. It is not chapter 5. It is a chapter 4 concepts only. In the beginning of the chapter 4, you have models, approaches to explain. So this is the area. See, cognitive therapist is working. Exploring childhood attachment. Sorry, this is psychodynamic. Using desensitization to reduce. Desensitization is only for phobias. Option C. Helping the client identify, challenge their negative. Yes, this is the cognitive therapy. Now, this is the cognitive. So option C is the right answer. Fourth one. The cognitive model explains abnormal behavior primarily as a result of what exactly you see? Dysfunctional patterns of thinking, including cognitive distortions and maladaptive schemas. This is the right answer. The cognitive model. Always please try to understand unconscious drives, psychodynamic, environmental reinforcement, behavioral, barriers to self-actualization, humanistic. So what is the left for us is dysfunctional pattern of thinking. Thinking basically related to cognitive model. Irrational, illogical thoughts. Fifth one, a behavior therapist views a child's disruptive classroom behavior as abnormal from this perspective. The therapist most likely explain the maintenance of this behavior. Fifth one again, B here. B is the right answer. The behavior is being unintentionally reinforced by the teacher or peer attention. Unknowingly, unintentionally, sometimes we give the positive reinforcement. You see, here it is. Now the sixth one is which therapeutic technique is most consistent with the behavioral model for treating phobias? Yes. So within the given options, actually phobias can be handled with the support of desensitization. Within this one, exposure therapy or desensitization, both are very good. See, in desensitization, we have in vitro, in vivo. Exposure therapy is a part of desensitization. From a humanistic perspective, abnormal behavior is primarily seen as a consequence of, lack of self-actualization, lack of free expression of emotions. Actually the right answer. Now within the given answers we'll see blocked personal growth, lack of self-actualization. Yes, very good. Lack of self-actualization and incongruence between one's real and ideal self. Yes, this is the right answer. It is the right answer. So blocked personal growth a lack of self-actualization and incongruence between one's real and ideal self. Now, a humanistic therapist, you see here, I'm sorry, my children, some teachers are coming to talk to me in between. Okay, eighth one, a humanistic therapist would emphasize which of the following as central to helping a client overcome their difficulties and move towards psychological health. If you see here, eighth one, B is the right answer. Empathy, congruence, unconditional regard, these are the core elements of humanistic therapy. The congruence is the balance between the real and ideal selves. So, for example, you see, if it comes to you the same question, as humanistic therapist we are calling, you know, these answer empathy, congruence, unconditional regard is it's getting matched with this within the given options. Actually, this answer is for the client-centered therapy more suitable. Of course, both are same. Humanism. See, Maslow and Rogers are both the two people proposed. But this given answer is more suitable to client-centered therapy. So, just a minute. But now it's like a tricky question for you. Little bit confusing. That's the reason I kept it for humanistic therapy. Now, if it is given the same question, for example, if the answer is kept as a question and options are given humanistic therapy, client-centered therapy, your choice should be client-centered therapy because it's more close to that one. According to the existential model, an individual's anxiety and feelings of meaninglessness in life might be primarily attributed to, the inability to find the meaning in life. So, confronting the fundamental realities of freedom, responsibility, isolation and death. See, ninth one, C. Actually, when we don't have the freedom, responsibilities, when we don't know what is our responsibility, when we are isolated, and death, basically the main reasons here. Now the last one, which core concept is uniquely emphasized by the existential model in explaining psychological distress? Which core concept is uniquely emphasized? You see, the inherent anxiety of facing ultimate concerns such as morality and the search for meaning. You see, here it is. These are the right answers, and in this paper the answer key also there for you people, my children. Have a look into this area and try to prepare. God bless you and take care. See, whatever the efforts I am putting for making a video, if you really like it, if you feel it is very comfortable, the explanation is very clear to you, try to just like it and share with other students from